Welcome everybody to this lunchtime webinar for paediatricians. I'm Lou. I'm the training manager for Down Syndrome UK and Positive About Down Syndrome, and I'm joined today by Caroline Turner, who's our maternity manager and regional maternity coordinator for the North East and Cumbria. Both Carol and I run our own Down Syndrome support group, as well as working for Down Syndrome UK. Positive About Down Syndrome is our professional arm of the charity. So I'm going to just quickly give you a quick overview of us as an organisation, some of the research that we've had concerning our lived experience of paediatricians, and talk about best practice and signposting to help you support the families that you come across. So Down Syndrome UK, we're a national organisation. And as I say, Positive About Down Syndrome is our maternity and healthcare professional arm of our charity. So we've been going back 7 years, and within those 7 years, we've done an awful lot in terms of helping support both families and professionals. We've done quite a bit of research into how women were given the news their baby has Down syndrome, done quite a lot on breastfeeding. We work with health visitors. We're now working also with the Royal College of Midwives on a suite of learning modules. So we're a parent-led charity, and as such, we consider ourselves to be the experts through experience. We know what a good experience should feel like, and we're empowering our families to make sure they're getting the best experience. But we also empower professionals to make sure that you know that you're providing, that experience with. We hope. Oh, the aim of, sorry, whenever we press record, my words go out the window. So we believe that every person, every family should experience, who has a child with Down syndrome or is expecting a child with Down syndrome, can continue along their journey without coming across any out-of-date attitudes or discriminatory or negative language. So we're empowering professionals to make sure that they're providing that kind of service. So we work with hospitals, universities, all sorts of healthcare professionals, and we provide this kind of training, and we're also able to provide a lot of our literature for free for hospitals. So, but Caroline will tell you more about that. So just to show you how we support, the demographic of who we support and how many we support. We've welcomed over 300 babies through our Expectant Women close Facebook group, and we're supporting loads of families, and our school service is very well populated as well. So we work really hard to make sure that every expectant and new parent of a baby with Down syndrome is supported. We provide that information and support, which is peer support, but also we offer them advice through our lived experience. And we talk to the professionals, and we pass on advice that way as well. Just to show you that we are a well-used service, and we're a well-respected charity. We surveyed our parents last year just to make sure that we were giving them the information that they needed, and they trusted the information that we give them, and thankfully the results came back really, really good. So what do parents worry about when they're given the news that their baby has Down syndrome? A lot. These are common experiences. Both Caroline and I are parents, and I have to say I certainly felt all of these things. One of the main worries is I don't want my other children to be burdened. What is the impact of having a sibling of a sibling with Down syndrome? I mean, the statistics show that there aren't any. There's no statistic evidence of a negative impact. In fact, a lot of siblings of children with Down syndrome go into the caring profession. Another worry is they'll never fit in, they'll live with us forever. That's certainly something that I worried about for my son Billy, and the impact on our life. But I work with young people with Down syndrome as part of the National Down Syndrome Policy Group to get their voices heard in Parliament. And I have to say that none of the young people that I work with want to live with their parents. that was a bit of an epiphany for me. I have no idea why. They just they're striving to get those skills so that they don't get interference from their parents or support workers, so they can live independently with their friends, with their spouses, and definitely not with their parents. And they want a job, same as everybody else. So parents often worry about, will they be able to cope with the extra pressures of bringing up a child with Down syndrome? And I have to say that as Down syndrome has been around for so long, and there's been such a lot of research in the way that people with Down syndrome learn and the health issues that they might have, there is an awful lot of support there. And I think we're in quite a privileged position in the fact that we get a diagnosis at birth or before birth. So that support network is there. And where do I get help parenting a child with Down syndrome? And like I say, there is an awful lot of support there. And as an organisation, we feel like we're covering most bases of bringing up a child with Down syndrome, as Caroline will tell you. So as you know, times are changing for people who have Down syndrome. You can see that there are a lot more people with Down syndrome in the media, and that is making a really big difference to people with Down syndrome themselves. Seeing themselves represented is making a really big difference to them. And the fact that children and adults with Down syndrome are living longer and more fulfilling lives is down to that research into education and the availability of early intervention programs, making a really big difference to children with Down syndrome as they pass through the education system. Improvements obviously in healthcare and support opportunities have a knock-on effect, improving the quality of life of people with Down syndrome, giving them a role in the community, and obviously having a knock-on effect on their life expectancy. So a lot of people with Down syndrome are now leaving home, forming relationships and working. They want to get paid work like everybody else. What we're finding is, you probably know the statistics of less than 7% of people with learning disabilities get paid employment, and a lot of these young people with Down syndrome are getting a lot of experience in their voluntary work, which isn't being translated into the paid workforce. So that's something that we're hoping will improve, you know, as time goes on and with the Down Syndrome Act. So in terms of healthcare professionals and paediatricians, we're asking you to think about your attitude and understanding surrounding Down syndrome. Parents look for you for information and support, and we just want to make sure that you're giving parents not only the information but also the support that they need. We're hoping that, you know, professionals don't limit and dismiss what people with Down syndrome are able to achieve. We find that quite a lot, actually. I mean, also parents, hand on heart, I had very low expectations of what my son was able to achieve, and that, thankfully he's bashed through all those low expectations quite significantly, actually. So if you have an outdated attitude and assumptions of what people with Down syndrome, low assumptions of what people with Down syndrome are able to achieve, that comes hand in hand with an unconscious negative bias. So in terms of the work that we've done and the research that we've carried out, some of which has been published, we had a PAD Sharing the News survey, which was published in the British Journal of Midwifery, and we have now got what we're calling the Warwick Report coming out later this year. The Warwick Report is a expanded version of our first Sharing the News survey, and we've had a PhD student from Warwick University working on this. And that will be hopefully published later this year, pretty soon, actually. So in terms of the questionnaire, we asked lots of questions. One of them was, did you get any information and support when you were given the news that your baby has Down syndrome? The orange block is our previous report, and the blue block is from our most recent report, the Warwick Report. So you can see that, you know, people are getting more information, but it's still, you know, quite significantly poor. In terms of support, again, in a little bit more support, but still, so this is, they had no support. 66% said they had no support, and now only 62% said they have support. So actually that's going down. We also looked at the effect on mental health, which we didn't in our original survey. So this is hot off the press. And in terms of their mental health, 31% felt they weren't given enough reassurance for the future. They were worried about their future of being a parent of a child with Down syndrome. And in terms of whether they felt they were given sufficient mental wellbeing support antenatally, only 34%, and that goes down postnatally. So very few thought they were getting enough mental wellbeing support. And that is, if you compare that to the national average of mothers who were surveyed as part of the Quality Care Commission report, 85% of the general population thought they had enough mental wellbeing support, and that's a big disparity there. And in terms of the effect on mental health, 37% of our mother surveys felt that the attitudes of healthcare professionals that they came across had a negative impact on their mental well-being. And if you want to know more about this, do have a look at the report that will be coming out. In terms of health issues that a lot of our parents, a lot of the children with Down syndrome suffer from, there's been quite a lack of support surrounding those. Breastfeeding, we've done some research into, but 57% felt that there was a lack of support concerning constipation and nystagmus, which obviously is more common in children with Down syndrome. Nearly 50% of them thought that there was a lack of support concerning their nystagmus. So we did a bit of, we did a quick survey of our parents to find out what their paediatric experiences were like. I mean, we're going to show you best practice in a moment, but in terms of general feedback, we found that our families are saying there's a lack of up-to-date awareness of Down syndrome, that there is an element of diagnostic overshadowing, which obviously causes a lot of frustration and worry, especially in terms of constipation. Some of our families have said that they've been told that, you know, babies with Down syndrome have big tummies, and that's, you know, because of the Down syndrome. But constipation we've found is sometimes not dealt with. So diagnostic overshadowing can be a big worry for parents. Language, we advocate using person-first language. Caroline will go into this a bit more detail later on. But also think about using the words such as abnormalities and problems and disorders in terms of when you're talking to parents, it does offend them if you're going to be talking about their children having abnormalities. And in terms of problems, we found that a lot of clinic letters come out listing problems. So the name of the child, problems, and Down syndrome is listed as a problem. And for a lot of families, Down syndrome isn't the problem, it's the health needs associated with Down syndrome which is the problem. And putting problems on clinic letters is causing a lot of unnecessary stress and upset to families. Families have reported there can be a lack of communication between healthcare professionals, so different departments not talking to each other, and that obviously has an impact on parents, because parents feel like they're chasing certain departments, and when they get to the next appointment, they're unaware of the history of their child. Reasonable adjustments that are working really well for parents are using Makaton signing if their child is a signer, easy read for young adults, I suppose, with Down syndrome. Think about easy read documents and talking to the young person or the child if they're able to communicate rather than just to the parent. Think about bringing in the learning disability team for those teenagers. I'm sure you know this already, but this is just feedback that we came across. Sensory and behavioural issues, it's often it's not the child being difficult, it's because they have perhaps sensory issues or behavioural issues that are preventing them from, being compliant in appointments. Blood tests, what's really working for parents is that if they're able to apply the Emla cream at home, and also not either going to the paediatric blood test area where they have play therapists, or going to assessment units where they're a bit more experienced, because obviously blood vessels in our children are quite narrow. Continuity of care, families have said that if they're seeing the same paediatrician every time, it works really well for them. And obviously we would like longer appointments, and that's very easy for me to say, but that kind of having that time to discuss their child is making a really big difference to them. So how can you ensure that parents receive the best care and support? Obviously, we don't want to just tell you about the negative practice that we've found. We want to celebrate and share the good practice that we found. I'm going to share with you today the best experience for one family and the good examples of what good practice meant to these parents. They said that their community paediatrician is excellent, and I'm going to share with you the good points that they've told us about. One of the major plus points is to be given the secretary's email so that contact can be made easily and directly. A lot of people, if they're trying to get hold of their paediatrician, they can't, because they can't get hold of you. And obviously you don't want to be bombarded with phone calls from parents. But if the families are given the details of your secretary or PA, it's working really, really well. Obviously, the second point is to make sure that all standard referrals are in place. So this is obviously eyes, ears, speech and language therapy, so that should say SALT. Portage, early portage referrals can make a real difference. I know every area is different. Some areas don't have any portage, and some areas will have portage from age 1 onwards. But be aware of what is available in your area. Here we can get portage referral right from birth. There may be a waiting list, but even if we're on the waiting list, we're able to access those portage groups. So an early referral makes a really big difference. We're finding that OT referrals and speech and language referrals actually, and physio referrals it varies obviously in every area, but if there is a waiting list, let's get our children on the waiting list. Speech and language, we found that some paediatricians, I mean, I'm open for discussion because we'd like to know more about this as well, but some paediatricians are not doing speech and language referrals and waiting till that nursery place. Whereas we know that early interventions are key for our children doing well at school, well, and in life, giving them their best early start. So early intervention is so important. So those early referrals really do make a big difference for our children being successful in their lives, really giving them the best start. Blood tests, thyroid blood tests. We found that some parents are not given the results of those blood tests, and they worry. So if a short report pointing out what the blood test means and when the next one is, if that works really, really well for parents. Point 4, this is what the family had said that we spoke to for best practice, that as a paediatrician, to be aware of local support services from the third sector. So lots of organisations like ours, but also local support groups may be able to provide other therapies while they're on the waiting list for the NHS or outside of the NHS. So physio is one of an example of that. As an organisation, Caroline will tell you about what we're able to provide in terms of physio and other therapies. So sleep studies, the NHS guidelines recommend a sleep study at 2 years, and sometimes that's not happening. And I think that would be really useful for a lot of parents and a lot of children. So point 6 is around DLA and EHCP applications. If you're asked to do that, we've found that some paediatricians will say how great their child is and how much progress they're making, and they're walking now and isn't it great. But in terms of DLA, families are being refused DLA because professionals are not pointing out what their child cannot do. Obviously, all of our children are entitled to DLA. They have Down syndrome and they're under the care of many professionals, which children without Down syndrome are not. So if you're asked to write a letter to support DLA or EHCP, you really need to point out where that child needs support, where that child differs from a neurotypical child. And that makes a really big difference to parents as well. Be reassuring and calming when parents are concerned with normal activity. So a lot of parents may be really worried about things that are, you know, quite common with children with Down syndrome and don't actually affect them significantly. So, you know, that reassurance will make a really big difference to parents. Make parents aware of private-only services that may be interested in, such as the chickenpox vaccine. A lot of families have said they didn't know about the chickenpox vaccine. I mean, I'm not sure, you know, what the procedure is in your practice, whether you're allowed to do that kind of thing. The next 2 points are writing reports, and I know your time, you know, is stretched, but parents do appreciate a report, obviously, copying in other services, so they know that those referrals have been made. So we don't feel like we need to chase to see whether those referrals have been made, or if there's a delay. If we've got evidence to say that you've made those referrals, then that makes a massive difference. And also, if you can write at the end of this report when the next appointment is likely to be. Often parents have said that, you know, they've been told they'll be getting a follow-up appointment in 6 months, and 6 months passed, but actually they didn't really need one, and it wasn't a realistic thing to say. So those kind of things, from talking to our families, would make a really big difference to them in terms of best practice from our point of view. So I'm now going to hand over to Caroline, who's going to tell you, as a charity, the signposting that hopefully you'll find useful to the families that you come across. Over to you, Caroline.
Thanks, Lou. Hi, everybody. One of the things that Lou has already mentioned is around ensuring that professionals who are working with our families have a contemporary understanding of Down syndrome. And we want to, you know, make sure by supporting all of you and your colleagues in training that you all do know what it means to have Down syndrome in the 21st century, because obviously it's very different to what it meant to have Down syndrome some years ago. And that contemporary understanding really does, we know, lessens the stress that families experience, because professionals working with them have got a modern outlook. It really, as Lou has already mentioned, improves mental health for parents as well. One of the things that we really strongly advocate for everyone, for professionals and for families alike, is around the language use, because it really does reflect the tone, and it sets the tone, reflects the attitude of the person speaking. And families, I know it's different for different communities, but for our families and families in the Down syndrome community, using that person first language is so important, and seeing the child as the child and the person first before the condition. So you can see the example on there is that Billy has Down syndrome. He's not Down syndrome. He's Billy. He's Billy first and foremost. Onto some of the many things that we do, and health professionals tell us a lot of that they had no idea about the wealth and breadth of support and services and resources that we provide. So I'm going to share with you quite a few of those, and everything that you see today on here is available on our website in the parents and the professional section. So there is a lot for you to see, to share with colleagues, and to share with your families, hopefully, as well. So these are our key online support groups for expectant women and for new parents and for preschool parents as well. They are very, very well used, and a lot of families tell us that they are, you know, the lifeline that they really, really needed to see them through their pregnancy and through the early years of their child's life, because not only do we have peer supporters on there, we also have professionals who are part of those groups as well, providing support and advice in different areas. We've got a range of publications which are available as books and as ebooks too, and again also available on our website. Our Nobody Told Me book is our key publication, which we provide for new families, and also is available to purchase as well, and is sent out in our resource packs. And that's the stories that families have shared with us of their real life experiences of having a child with Down syndrome. That's from newborn babies right through to adults who have Down syndrome. So it's a really great resource. The little orange book of knowledge gives parents really lots and lots of key information about the services and the professionals that are going to be involved with, because a lot of parents don't know what a portage worker does or why they might need a dietitian or what a physiotherapist is going to be doing with them. So that book provides that that extra information that parents of a typical child probably wouldn't need. Our heart experiences, heart surgery lived experience book tells the story of lots of families who've had a baby who've gone through heart surgery, and our lived experience breastfeeding document is about the successes and support of breastfeeding a baby with Down syndrome. And I'm going to tell you a little bit more about both of those. So Rosie is our Heart Buddy coordinator. So please do, any families that you know who have a child who has a heart condition where the baby or the child is going to need surgery, please do signpost to our Heart Buddy service. And the Heart Buddies enables parents to be buddied up with somebody who's been who lives in their local area, or baby and child has had surgery in their local area, to make sure that they've got that peer support and they've got some information about what the experience is as somebody to talk to, because it can be a really difficult and challenging time for families. So that support is available. It's a really great service that we offer. Next slide, please, Lou. As I already mentioned, breastfeeding a baby with Down syndrome is something that we're really passionate about, because we know that many of our babies do successfully breastfeed for extended periods of time, and it's just getting that right support in place to start with. And we know that also there is somewhat of an assumption sometimes that babies with Down syndrome, for various reasons, might not be able to breastfeed. Sarah Oja, our breastfeeding coordinator, runs training. She is a highly experienced breastfeeding peer supporter. She delivers online training to professionals across a wide range of professions and backgrounds. And she has also published 2 publications and written widely in journals too as well about the successes of breastfeeding a baby with Down syndrome. And as you can see there, the statistics show that when well supported, our families who have babies with Down syndrome do successfully breastfeed for extended periods of time. And it's just about getting that right knowledge and support in place. Another project that we're really proud of is our Pants for Schools programme. And this is run by Jo Tyndall, who's the Pants for School coordinator, and she works alongside June Rogers from Bladder and Bowel UK, who's our expert. And June runs the programme to enable parents to be able to toilet train their children ready for school, so that children are going to school in pants. And they have huge success with this programme. And it's a 4-step programme, which there's a lot more information about it on our website. But suffice to say, there are online support groups, and also she runs online groups targeted to groups of families who are all going through the programme at the same time, to give them one-to-one and small group peer support, and that works extremely well. And we know that a lot of our families start toilet training from when babies are very little, able to just sit up, getting them used to going on the potty, all the way through to being ready to go to school in pants. So that's a great programme. Please do signpost your families to it. As Lou already mentioned, some conditions that our children have more commonly, such as nystagmus being an example there, perhaps families don't always necessarily get the support that they want. And so we've got a publication available again on our website around the needs of children who have nystagmus. And we work really closely with Dr. Maggie Woodhouse from Cardiff University, who is the leading expert in vision for children with Down syndrome, as you may well know. So Maggie is continuing to work with us and provides online training too for parents. In addition, we also have online physiotherapy, because we know that physiotherapy can be somewhat of a postcode lottery dependent on where families live. They get different levels of service. So physiotherapy is included in our early development groups, in addition to fine motor skills, speech and language and memory, work on early numeracy and literacy skills as well. Those are all included. So families are put together in groups and have those online sessions, which again are terrific for families who maybe don't have a portage service or an active physiotherapy or an online or a local support group that are particularly active in their area too. So that makes sure that families have access to all of that support that really they should be able to through the groups that we run. Something that again you might not be aware of, and we hope that not very many families are going to need this, but we do provide this service called PADS Cares, and it's a bereavement support service. It's a closed online support group for parents and grandparents if they have lost a child or a grandchild. Obviously, very challenging situation to be in, and we want to know that that we've got peer support there, professional support's available as well, because we do have a counselling service that we provide to, which parents can sign up to if they would like to. As I've already said, a wide range of services that we provide, but this is some of the many different kinds of training that we offer for parents and for professionals. In fact, Lou's already mentioned DLA. We provide Makaton training online. We provide behaviour training. We know that our families sometimes need support with accessing social care, so there are sessions on that. There are EHCP drop-in sessions to make sure parents know the processes of how and when they should apply for an education, health and care plan for their child. Support around choosing a nursery. Things like information about infantile spasms that parents might not know about, that might have some concerns about. So there's lots and lots available in our training sessions for both parents and professionals to access. We are very fortunate to have Dr. Becky Baxter as our Director of Education and Speech and Language Therapy. Becky is an highly experienced and very well-known professional speech and language therapist who is not only working with our families around speech and language therapy, but also around early education as well. One of the important things that she works on with families and wants to reiterate to parents is to make sure that it's understood that our children have a speech and language disorder as opposed to a speech and language delay. And also to really raise the profile of the fact that our children have a specific learning profile when they have Down syndrome. So those are part of the training that she delivers as well for professionals as well as for parents too. And as you can see, there are lots of things that she does more widely, and that's a really that's in its early stages, and we're really developing that. That's going to be a much bigger project to make sure that support and that information is more widely disseminated to families and professionals. So a little bit of information about a summary, really, I guess, of the things that we've talked about, the key points, takeaways for you. We always really, as I've already mentioned, push the importance of considering your language and not being sorry. Please don't be sorry for our children having Down syndrome, and please think about the impact that language can have. As I said, person first language is really important, and it does have the language that professionals use has a real impact on the way that parents can connect with their baby when they're young as well. That contemporary understanding is really important. As Lou also already mentioned, our young adults and teens have aspirations. They don't want to live at home necessarily. They want to be part of society. They want to have a social life, get out there and have jobs. They want to do the things that other people their age want to do as well. Not all parents have different levels of knowledge about what it means to have Down syndrome. So it's very much dependent on individual families. Some families might know lots, some might have very little knowledge. So it's really great if you can signpost to our website, because there is a huge amount of information on our website for yourselves and for families. We want high expectations for our children. We know our children develop at their own rates, not necessarily the same rates as typically developing children, but they can reach, and they can and do reach milestones. So it's really important to stress that and remember those successes as well. As I've already mentioned about seeing the individual, our children and young people are an individual first, and their condition comes second. As Lou mentioned earlier on, please be aware of diagnostic overshadowing, because it's the conditions that some of our children have that are in addition to having Down syndrome. What would it look like if that child didn't have Down syndrome? What would the care look like, and what would maybe the referrals that are made look like? So this is a little quick handy overview of all of our groups with QR codes. This comes out if you order one of our resource packs, which includes posters, a copy of the Nobody Told Me book, and there are QR codes to all of our groups and links to our groups and our website, which, as you can see, there is a wealth of, and there are also some links in there to the e-copies of the books, such as the Little Orange book and the lived experience book that I mentioned. So a really handy little quick guide for you there as well. We deliver a training nationally across the country, online to parents, to professionals, apologies, a lot of it to midwives and maternity staff, but we deliver training much more widely than that to health visitors. We've been doing a lot of work with health visitors recently. And we're working with universities a lot to work with trainee midwives, to work with students in all aspects of healthcare as well. So our training is really, really well received. On here, quickly, you can see we've got an online group for healthcare professionals, which all and any healthcare professionals are very, very welcome to join for updates on what we provide. And I would really like to encourage you to take a quick look at our website when you have a few minutes. One key feature of it, which is really important for a lot of professionals and families, of course, is our accessibility bar, which enables it to be translated into any language that is needed, which enables it to a really great resource for families for whom English is not their first language. So yeah, all the information that we've talked about today is in the professional section, and there is a new section on there about for paediatricians in particular, and it's got some new documentation, including a report that we've put together, which is a bit of a summary of some of the things that we've talked about on here. So please do have a look in the paediatricians section on the professionals tab on the website.
And I think that's about it. We do these monthly lunchtime webinars, but we haven't come up with our program for the next 6 months, so it's still in planning. So if you join the closed Facebook group for medical professionals, then we'll be able to give you an update on any next webinars that are coming up. And if you have any particular subjects that you would like us to cover, do let us know, because we want to make sure that we're giving you the information that you need.